and awareness.
And joining us now to outline plans for improved health and safety at universities is the CEO of Higher Health South Africa, Dr. Ramneek Ahluwalia. Dr. Ahluwalia, good evening, and thank you so much for your time tonight. Certainly, I mean, we are in the midst of a highly transmissible variant, and, even schools themselves have had to delay reopening, and also some of the parents raising concerns that even come 15th of February, they don't even know if they'll be able to send their children back to school. Looking at higher education and training, the minister has come out to also talk about some of the fatalities that have also taken place in that particular sector, even talking about just how important it is going to be to ensure that things are done in a safe manner. How important is it going to be, particularly when, institutions of higher education and training resume, for measures to be put in place, stringent ones, to ensure that some of these fatalities that have been recorded are not seen again?
No, thank you, Bangiwe, and good evening to you and everyone. You're absolutely right. We are a very vulnerable society and kind of a community in South Africa, whether universities or TVET colleges or colleges in general. And, we've got thousands of young people entering our gates and premises on daily basis. And clearly, the science has now clearly shown that this virus has almost equal affinity to young people as it has to old people. Yes, the young people have high potential to be asymptomatic or mildly symptomatic, but it's not true that we have not experienced fatalities or young people also being very severely affected sometimes to this pandemic, but less compared to old people. Now, the biggest challenge remains for us is when thousands of young people are coming every day into our campuses, how do we prevent systems and how do we put strong controls and systems in order to ensure that we are ensuring that we are isolating early phases of people who are infected with COVID and allowing only people coming into our campuses, which are in close affinity with each other. We've got classrooms, how do we put systems there? We have exam centers, we are conducting millions of students' exams on routine basis. We have residences in our premises. So how do we ensure that every bit and corner of our universities and TVET colleges have strong systems and controls? We've done well comparative to how the worst has hit South Africa. We've conducted millions of students' exams since July. TVET colleges' whole academic year has been completed. Many universities' academic year has been completed. But there are certain universities who are opening now to ensure the academic year completes and students come and write exams. So the protocols that we have put for exam invigilation, right from engineering of the room, how they enter from many doors so that there's no congestion at the doors, invigilation, quarantine of papers before they are marked, examiner preparations. So it's a lot of field work that goes into every bit of ensuring that precautions are taken at every corner towards having these thousands of students at one time. So these are vulnerable places, there's no doubt. And that is the massive challenge. And through this, your platform and to everyone in our community, students, parents, and guardians, it is our own responsibility to ensure that we look after the other one. And we have the social compact that we have to build between students and academia, between management, between frontline workers, that everybody takes responsibility and accountability at this stage.
And I mean, when you look at, a period like this, it has not only been stressful for adults, it's also been quite a time of a lot of anxiety, especially for, young people. And the minister has also been touching on this, quite a lot, especially in his briefings and even in his last one where he was talking about just how important it is for a lot of young people to still be able to get access to maybe some of those HIV treatments, being able to also then report gender-based violence issues and all of that. How easy has that work been, particularly during this time, in order to be able to navigate during this time and also to ensure that you're not seeing, levels that are extremely high of anxieties to the point of not being controllable?
Bangive, you are raising a very important point, very critical at this stage. We have built enormous structures over centuries, over decades, on our HIV program, on our mental health program, on our gender-based violence initiatives. And now COVID, it takes entire attention, infrastructure, systems, thousands of our volunteers, the frontline workers, everybody's focusing on COVID. What higher health did well, which I would comparatively say, is predominantly focusing, not losing the focus on our other pandemics that are running parallel or in fact growing under the umbrella of the COVID. And the same infrastructure that we are putting for COVID, like the screening stations that we have built at the gates for thousands of students coming in to be screened, we are now offering HIV services, gender-based violence services, mental health services right at the corner along with the COVID-19. Because there is no doubt, we have a 24-hour crisis helpline that we launched in August. And since then, about 5,000 crises have been managed. And you can see this is an enormous amount of pressure and anxieties that students and our community of academics and staff are experiencing within our post-school education due to the uncertainties or challenges that COVID brings in. They are seeing people dying in their families. They are seeing they have the hope of an academic calendar and the disturbances in academic cycle and the challenges of finishing an academic year. These are enormous pressures. Their own graduateness to come and go into the workspace, whether they'll find jobs, is adding a lot of stress into people. So 5,000 crises, it tells us that how many young people are actually feeling the heat of COVID-19 and how the mental health has been increasing. Parallelly, we have seen calls of crisis on gender-based violence. And we've seen about over 50,000 young girls being and students being put on gender-based violence support services, predominantly in the lockdown period within the post-school system. And this can clearly show that we are amongst the most difficult times probably in our own lifetime. And all these other pandemics cannot be forgotten. And under as much as COVID takes the emphasis, and no doubtedly this time, every attention has to be on COVID due to the way the spread of the pandemic has caused fatalities. But the infrastructure we have put for COVID has to be now utilized to keep on our parallel services of other pandemics continue, because otherwise we lose sight and we'll come up into a time when COVID might be slowly coming back into its real sense of going back away from our human life, but other pandemics would have taken a huge storm from there on. So we can't let our fight on other pandemics go down.
I wonder then, how many calls are you then receiving from some students that are also anxious around online learning? Because we have been speaking to quite a number of them that have also been talking about just how, access to laptops themselves is not so easy, access to data for them to be able to continue with their studies is also not easy. Even after some of them get access, they still then battle with just the system in and itself, because even some of their lecturers are not able to even be able to utilize the system in a very friendly manner. Insecurities
are everywhere, whether it's an academic cycle, and you're right. I mean, the real fact is that students are experiencing, specifically students who are in deep rural areas, so students who do not have enormous access to good 4G or a 5G or a 3G internet data source, so that they can be connected into the system and be able to continue academia in the way academia would have been. Ideally, everybody wants a blending education where there's a contact learning and there's an online learning. COVID has created a lot of challenges, and that is why higher health had to put a lot of infrastructure with the management to ensure that classes do happen, so that students do come on campuses. As soon as the level of lockdown started reducing, our challenges was how do we bring students back into our campuses, keep them infection-free, keep them prevention-free, and give them access to the same kind of academic support that they would have required in the non-COVID period. It has been challenging, and we are experiencing stress calls on insecurities of careers, insecurities of examinations, not having confidence on how it should have gone in their own spheres. And to be very honest, this is a real test of human character and human personalities. Young people are anyways coming out of into maturity. They are coming to become adults. And at that stage of life, it's experiencing such kind of insecurities massively increases anxiety and stress. And add on is gender-based violence and many other spheres that they experience within their own lives and communities. So you're spot on. I cannot add on further. Support structures are there. Through your channel, I would like to still market the number 0800 363636. 24 hours toll-free, free helpline of mental health by Higher Health. Call this number, seek help. But if it is 2 o'clock in the morning, we cannot let our young people die through suicides or committing wrong or committing some severe challenges through living alone and trying to live with this anxiety and stress or depression or other mental disorders alone. You have to speak to it. You have to seek help. And a very experienced team of psychologists, social workers, counselors are 24 hours available just to ensure that we do not lose these young South Africans at this stage.
And Dr. Ahluwalia, you said the number 0800 363636.
36.
All right, correct. Thank you so much for your time tonight. That number again that Dr. Ahluwalia just, basically read out to students is 0800 363636 to ensure that if you have any anxiety-related issues, and be able to find a counselor to speak to at all hours of the day. We certainly do appreciate your time tonight. Thank you so much for this conversation. That was CEO of Higher Health South Africa, Dr. Ramneek Ahluwalia, outlining plans for increased health and safety at the country's